Should I introduce y'all or would y'all like to introduce? We have Shane Arnett, she's our peer support specialist with ADAPT. We have Chris Tyler, who's our SUD counselor with ADAPT. We have Kathy Leach, she's the executive director and co-founder of Mobile Integrated Navigation Team, which is MINT here in Josephine County. And we also have Clayton, who is representing UCAN tonight. I want to give a special thank you to Douglas Cleveland, who's really worked tirelessly to help me with the seminar. And also to Tyler, who's also representing the Drug Foundation tonight. He has a table, so if you'd like to learn more, feel free to check him out tonight. Alrighty, so today we are talking about bridging the gaps, homelessness and social determinants of health. I know before talking to our experts, I did not realize how much goes behind the scenes to understand, you know, from the homelessness perspective of accessing healthcare. And I'm so excited to be having this seminar tonight. So up first, we will hear from Shane Arnett, who's going to be sharing her personal story with us. And I'll pass it off to her. Thank you.
Hi, my name is Sheena, and I'm a recovering addict. My recovery journey started September 23rd, 2017. I really gravitated towards a certain crowd in high school. Started drinking and sneaking out and smoking pot and just rebellious, super attracted to that. And before I knew it, I graduated high school and I quickly found myself with a heroin and meth addiction. There was this one night that I met this guy in a bar, and he invited me to hitchhike with him out to San Francisco. And I took him up on that. I ventured to the I-5 the next morning. I hitchhiked with him to the city, and I found myself in this city, homeless for the next 7 years, 7.5 years. When he took me there, he promptly ditched me. And I was this young, I found myself like walking into the unknown, into a world that I did not comprehend I was entering into. I continued on there for 7.5 years as part of the homeless population, living on the streets. About 7.5 years into my story, a dear friend of mine named Scotty, may he rest in peace, he OD'd 3 years ago from a drug overdose. He bought me a Greyhound ticket home. He was watching me deteriorate at a rapid pace. He watched it for years and was really concerned about me. And he was just like, go home, you know? Fortunately, my mom had an open door policy. I had tried a handful of times before that to get my life back on track. In the middle of the night, I would disappear and I'd call my mom while I was in the city and I'd apologize that once again I hitchhiked back to the city and I was back out there, what I was used to, right? But with that open door policy, my mom invited me back in and I started to gradually build my life back piece by piece. I had to let my, part of that healing was I stayed really small for a while. I had to learn to use my voice again. I had to learn to calm my nervous system and let my brain heal. You know, I got integrated into community supports pretty quick, thankfully. Part of that for me was going to outpatient and adapt. I'd done that several times previously, but this time I made the choice to stay and stick it out. That was huge for me and the foundation and learning the tools that I needed. I integrated into Narcotics Anonymous, which led me to Alcoholics Anonymous, which led me to ACA, Adult Children of Alcoholic and Dysfunctional Families, where I get to do inner child work and work on some things that are below the surface. which led to the suppressing of my feelings with substances in the first place. Yeah, it's been a beautiful journey. I'm super grateful to the supports within the community. I remember there was this friend of mine who asked me at one point if I could be anything I wanted to be welcome. At that time, I hadn't really thought about it, but I did know that I would love to use my story to help. A few weeks later, he let me know about peer support. I knew about peer support, but I never made the connection that it being something I would want to do for a career. Fortunately, I came in and I applied at my local outpatient at TAPS, and I got to take on a role within this agency. It's been really powerful getting to be a part of planting seeds and giving up, like, using my story to like encourage hope. And it's really freaking beautiful work, you know. I'm super grateful that for the life I've lived, I feel like it's given me the purpose to like be up here and share my story in different ways. And one of my favorite things about that is, like I mentioned, like I didn't know how to use my voice on my phone, right? A couple years ago, I couldn't imagine myself up here speaking. I'm really grateful that my 28-year-old version of myself decided to give myself a chance. And my friend bought me that ticket, and then I made my way home because there's this woman inside of me that's wanted to heal and come out, and I just never really gave her the chance to come out. I'm so grateful. Thank you.
Thank you. I'm deeply touched by your story. I'm sure most of are as well. So thank you for sharing. Up next, we have Chris Tyler. He is going to be introducing social determinants of health.
Well, first off, I want to thank you. Is it not working? There you go. Hey, hello, everyone. First off, I want to really thank everyone for joining us tonight, either in person or on Zoom. Excuse me, on Zoom. I think this is an important topic that we need to discuss, and I'm glad that we have this forum to do so, because it's an important topic, right? You know, people's lives are at stake here. You know what I mean, when it comes to these certain things. So first off, I'm going to start with the wellness well. And before I start with the wellness well, I want to encourage you guys, if I may, to think about where you're at in your life today. Think about your wellness and what that looks like for you today. Think about the struggles that you have today. Think about those things and aspects of your overall well-being, right? Now let's take it a step further. Let's think about the people that are less fortunate. The folks that are out there in the rain right now. The folks that don't have those opportunities because of X, Y, and Z, you know, the barriers, the stigma, all these different things that people that get trapped in that cycle, right? And how do we come together as a community to help support those folks? Whether you're a provider, whether you're a normal citizen out there, you know, the focus tonight, and I'll talk more about it, is to come together as one unit for one cause and to better support our community so our community can heal. So our community can heal. And we talk about the wellness, you know, as providers, we talk about the wellness with our clients, right? With like in these 8 dimensions and where we are in those different dimensions and how do we excel or they're lack in, right? That determine our overall sense of wellness. So if I may, I want to, I know I have it on the board or up there. I want to just highlight some of these things. The physical aspects, taking care of your body through exercise, nutrition, and rest. Ask yourself, are you doing that? And imagine the other folks that don't have those opportunities. We talk about the social aspects, building healthy relationships and a sense of connection with others, right? It's about the human nature needs connection. We're all built to connect with one another. So when we lack in those things, it takes a toll on our health. Moving forward to emotional pieces, understanding and managing your emotions. Because as we know, emotions drive us to do certain things if we're not able to manage those aspects. Intellectual, keeping your mind active and engaged in learning and creativity. Spiritual, exploring your beliefs, values, and a sense of purpose and meaning in your life. Occupational, finding fulfillment in your work or your daily activities. Environmental, being aware of the impact your surroundings have on your health. Financial wellness, managing your money to support your life goals and reduce stress. So when we talk about the wellness world, we try to, look at these different categories. We try to figure out where we place in those things and where other people place in those things. And I can tell you, if you lack in one area, it has an impact on other areas of that will. And I can tell you that I was talking to an individual and we were talking about the wellness world, and he said, I got this job, but I got nowhere to live. Got nowhere to take a shower, to be able to have an opportunity to even go to that job. Right? And it has the different aspects and the different barriers that come with that wellness. So I just wanted to highlight that wellness world in regards to not only, like I talked about, the homeless culture, the unhoused, if you will, but for us in general. So it's something to think about when we go through this, the rest of this presentation. Right, you guys, let's talk about the social determinants of health. Let's take a look at what this looks like. Now I'm going to read verbatim. You guys can follow along because it's way too much information for me to remember. So, and I wanted to make sure that I got the details correct. So let's go through this. Social determinants of health involves addressing the various non-medical factors that influence people's health outcomes. These factors include economic stability, education, social, community context, healthcare access, and the physical environment. How do we define social determinants of health? The conditions and places where people live, learn, work, and play, which affect a wide range of health risks and outcomes. These factors play a critical role in determining individual overall health, access to care, and life expectancy. Let's talk about some of these key categories of social determinants of health. The first one we want to highlight is the economic stability. Income, employment, and financial security can directly affect health outcomes. For instance, people with higher income levels tend to have better access to health foods, health care, and housing. Education. Higher education attainment is associated with better health outcomes. Access to quality education can empower individuals to make informed health decisions and gain economic stability. Next piece is social and community context, social relationships. Community supports is why we're here tonight. Community supports and safety can all impact the mental and physical health. Strong social networks often correlate with better health outcomes. Moving on to the next piece, healthcare access and quality. Access to affordable, high-quality healthcare services is essential for preventing and treating illnesses. Neighborhood and built environments. The physical environment, including housing quality, air, and water, clean water. Water quality, and access to healthy food, safe spaces for physical activity and greatly influence health. Let's move through some statistics. In 2022, the CDC reported that people with income below the poverty line were twice as likely to report poor health as those with income above. Well, a person with a college degree is expected to live on average 6 to 9 years longer than someone without a high school diploma. Studies show that individuals who experience high levels of discrimination are at 60% increased risk of developing chronic health conditions like hypertension. The uninsured rate in the US was approximately 8% in 2022. People without insurance are 3 times more likely to postpone or forego medical treatment due to the cost concerns. Nearly 24 million Americans in food deserts. Food deserts. That means they're not having adequate food within within a distance in our rural communities. Like the grocery store could be 50 miles away, and they don't have access to that. So that kind of explains what a food desert is, those who didn't know what that meant. And people in these areas are twice as likely to develop obesity-related conditions such as type 2 diabetes. Right, how can we come up with solutions to improve the social determinants of health? Expanding access to quality education, increasing affordable housing options. You know how much of that is a struggle. Promoting policies that reduce income inequality. Improving healthcare access for undeserved population. Invested in community-based health initiatives. My favorite part of this is call for collective responsibility. Collaboration between governments, community, healthcare providers, and individuals to address social determinants of health and create a more equitable society. In conclusion, these social determinants of health create a broad, complex picture of how various aspects of society impact well-being. Addressing social determinants of health through policies, community investments, and individual support can help close the health disparities, ultimately leading in healthier, more equitable communities. Talking about some of these things and going through what we're going through, starting with the wellness, going through the social determinants of health. There's a lot of things that come to mind, and I'm going to touch on a little bit of like the provider aspect real quick, if I may. Whether you're a counselor, whether you're peer support, whatever that looks like from a provider standpoint, we try to focus on these things when individuals come in our doors. We try to meet people where they're at, and try to say, instead of like, what's wrong with you? What happened to you? What happened to you that got you in this position? Let's talk about it. Let's be open and honest about what's going on so we can provide the best course of action from a provider standpoint. And I'll tell you this, and I'm going to highlight peer support real quick, because peer support is on the front lines. You guys are out there in the community, in the parks, in the camps, in the. You guys are out there, I can tell you for what I see with the DAPS peer support, and I know other providers have peer support and they're out there doing the thing. But I'm going to tell you about DAPS peer support, if I may, real quick. Let me tell you something. In the office, I'm seeing these guys. They're whipping around. They're in and out of the office. They're out in the rain. They're taking people to treatment. They're taking people to court dates, getting healthcare, food boxes. I mean, you name it, mental health services, helping them with resumes, taking them to job, yeah, those things. You know, they're out there doing this to help the social determinants of health, helping folks thrive and have a sense of well-being. Have a sense of well-being, because I know everybody in this room wants to have a sense of well-being. I want to be able to feel like I belong. I want to be able to have meaning and purpose. Do you think we're the only ones that want that? No. We have folks right down the street that want that don't have the opportunity because life happened. Whether they struggle with drug addiction, drug and alcohol addiction, whether it's mental health stuff, whether it's just fallen on bad times. And I can tell you, there's a lot of folks out there that have just fallen on bad times. I lost my job, I wasn't able to pay for it, and now I'm living in a tent and I'm lost, and I don't know what to do. And having this discussion and coming together as a community of how can we come up with solutions to help these folks? Because I can tell you, if we can address the social determinants of health, it can end homelessness and or prevent it. But it takes all of us. Like, I don't have all the answers at all. But I know collectively us coming together and having a discussion around this, we can come up with stuff. It's not gonna happen overnight, right? It's a process, like everything else in life, it's a process where we need to be. I want to leave you with a little story about a client that I had in the office not too long ago. He came in and it's from the house population, and you know, I was asking him, you know, how you doing? What's going on? And we just kind of talked about where he's at, and you know, just kind of lost. Just don't know how to just maneuver through life because you just feel stuck. And we started talking about, like, you know, are you able to unclean water? Some of the stuff we talked about. He's like, yeah. He said the camps, I guess they're bringing fresh water to some of the camps now. I don't know if is that accurate. Some of you guys that have been out there.
Yes.
I was like, that's cool. I'm like, so you get fresh water? I was like, yeah. I said, what about food? He's like, yeah, I eat where I can. But he said once a week they bring hot food. Am I correct too, Cass? They bring hot food out there, and he says, is it good food? He's like, yeah, eating healthy food. It's good food. I'm like, all right, cool. And then I said, you know, what are you doing to take care of your hygiene? How's that look, man? You know, because he came in kind of disheveled, and you know, he's like, Chris, I can't tell you the last time you took a shower. Can't tell you the last time I took a shower. I said, hey, why don't you go to the YMCA? I know you've done that before. I said, I don't have a license. I lost my license or it got stolen. Let's see what we can do to help you with that. He's all, Chris, I've had the same pair of clothes on the past 2 weeks. He says, you know what, Chris? In Medford, they have that mobile shower thing.
Yeah.
Mobile shower thing, yeah. And they, I guess they come in and they wash your clothes too.
Yeah, it's all in one location.
Yes. And I was like, he was telling me this, I was like, that's cool, that'd be cool if we had that in our community. I said, how would you feel if you were able to get a shower regularly? Or just be able to wash your clothes here and there? Like, Chris, that would be amazing. He said, maybe then I might have the confidence to get up and maybe go look for a little job somewhere. But I can't go like this. Can't go like this. So that's the peace, that humanity peace, that human peace. And like I said, us coming together and trying to figure out how can we bridge the gap to support our fellow humans, if you will. We're all in this together, and it ain't going away on its own. We have to come together to figure out how can we gain some stability, if you will, in the healing process. Thank you for letting me share that.
Thank you. That was wonderful. All right, up next, we have Kathy Leach. She is an RN, MSN, and she has her master's in healthcare administration. She is the co-founder and executive director for Mobile Integrated Navigation Team.
All right, I will try to be brief, I think most of you guys in here know who I am. I want to start with, I'm ridiculously passionate about health equity, and it is something that's very passionate to my heart. As a former ER nurse, I have to admit to you guys that I worked in the ER from, I think, 2007 to 2014. And the way I treated homeless people is appalling, because I didn't know any different. The way healthcare professionals are trained, they're not trained to look at health equity, they're not trained to look at social determinants of health. You know, as an ER nurse, I was trained to get people out as fast as possible because of throughput. And so I had a lot of moral injury working in the ER, because I would discharge people and I would feel really sad about it. I couldn't do anything else. And I was, so sometimes that moral injury would lead to me not treating them great, because when they came in, I knew I was going to be frustrated instead. So I want to throw that out there, because I'm also passionate about bridging the gap between providers in the community that are frustrated with the healthcare system and the healthcare system themselves, because everybody is doing the best that they can in the capacity. We just don't have line goals. That's what, boils down to. But in 2022, I was ridiculously burnt out for healthcare. COVID just that's it. And so I wanted to get back into why I got into nursing, which is serving vulnerable people. And going to Riverside Park with a wagon changed my life, offering vaccines. And I wanted to provide healthcare to them, but the more I got to know them, and the more I realized the lack of social determinant we have in this community and access to support, it made me sad. And so I made it my goal to one day become a street nurse. And I want to drive around in a medical van and find homeless people and give them medical care. But right now there's no point, because I just look to the side and there's almost, and there's no housing. And so it's really kind of right now focusing a lot on the housing aspects. So we can get to good quality healthcare. The second thing that I want to bring up, when we're talking about social determinants, we all know housing, financial insecurities, etc. But you did a really great point in talking about it, is 94% of people facing homelessness have endured trauma. All of us in this room have endured trauma. And we're able to get through that trauma because we have a safety net. We have people that love us, that are okay. Your mom, right? Like, she allowed you to come back into that home. And not everybody has the same safety net. Not everyone is comfortable enough to accept a safety net because of their trauma. And a lot of people, have childhood trauma where their safety net is what caused, them to be where they're at today. And it is become a passion of mine to make sure that people who are unhoused feel safe and loved. And if they feel safe and loved, and the more us service providers come together and wrap our arms around them, they're able to fail forward fast. And it's okay if they go to treatment and mess up, because we're all here to love things. You know what I mean? Like, that's part of the journey. That's the exciting part of the journey. That's just your face right now. And I have found that is probably the most critical component to providing care for the unhoused, is making sure they feel safe, loved, and no judgment, regardless of what's going on in their lives. And a lot of the times I get folks who ignore a wound and have a lifestyle where they don't care about their health until it lands them in the hospital. And then guess what? They're in the hospital, either they leave AMA, and I manage them out. Against medical advice, if you guys don't know that. But we help manage them outpatient and meet them where they're at. I have one guy who has horrible burns on his leg, and all he wants from us right now is supplies. So that's all I give him. As a nurse, I want to debrief that thing, I want to check on, I want to do all these things, but that's not where he's at. So I make sure he has what he needs, and he checks in when he needs to. And that's really what it's all about, is coming alongside where they're at and giving them love and support. And then I'll just close with, a little bit of a personal thing here, is that I didn't realize what I went through as a child until I started working with people in the unhoused community. I think it was probably 9 months into doing work in the unhoused community that I started having memories from childhood trauma that I had no idea. Because I don't have a lot of memories from my childhood. And so like, I am so thankful to the unhoused community for being my safety net. And their unconditional love and support, because they've gone through it, you know what I mean? And so I am 100% committed to, in this community, like helping to share the story of how amazing these people are, and yeah, that's it.
Thank you so much, Kathy. Truly appreciate you being here today. So up next, we have scheduled Amber Ridge, that is talking right now. I want to appreciate her being here, pulling it through, it really means a lot. She was doing outreach in Roseburg today in the rain, so I think that got to her. But thank you. So for Amber, we have Clayton, who is representing UCAN tonight, so I will give it to him. Thank you.
Hello, I'm Clayton, and I'm one of the homelessness outreach coordinators at UCAN. And today I'm here to talk about the facts and statistics around the causes of homelessness. So we have identified 4 main causes of homelessness. Of course, not every case falls under one of these 4, but 4 major ones are lack of affordable housing, poverty, domestic violence, and incarceration. So from the top, we have lack of affordable housing, and a third of renters in Josephine County spend more than half of their income on rent. Additionally, more than half of the renters in the county are rent burdened, which means that they spend more than 30% of their income on rent. In 2022, Realtor.com ranked Pass as the 3rd most unaffordable housing market in the nation. Josephine County also has a severe, or Josephine County just has a severe lack of affordable housing. Housing costs are rising faster than wages, and in 2022, a full-time worker needed to make an average of $25.82 per hour in order to afford a modest 2-bedroom rental, which makes living off of a single income, whether you're a single parent or just a single income family, pretty much impossible or difficult to do without any sort of social services or assistance. Another leading factor in homelessness is, of course, poverty. And in Josephine County, 41.8% of residents are below 200% of the federal poverty line. Josephine and Douglas counties exceed the percentage of the state living in poverty. Based on the numbers from Pitt, and taken in January 2020, Douglas County had a rate of 76 homeless individuals per 10,000 residents, and Josephine County had a rate of 98.8 per 10,000. If any of you are fast enough, you would know that Josephine County has a homelessness rate of around 1%. This room is filled. If every single chair is filled, one with the average Josephine County resident, one person would be homeless here. And to compare that to the state and the rest of the nation, Douglas is double the rate of the state. Josephine County is triple that rate. The state's rate is about 34.7 per 10,000. And both of these exceed every single state in the nation. Almost half of the residents are unable to afford basic needs like food, housing, and utilities, which increases the likeliness of homelessness. And this is pretty, to me, seems pretty straightforward. You can't afford to pay the water bill or the electric bill, which, if you can't pay the water bill, you're gonna have a hard time bathing, getting a shower, and that's gonna decrease the chances of finding a job or keeping a job. Can't get electrical bill. So many of the jobs nowadays you find online and you won't have a computer to access them, at least at home. Transportation is incredibly expensive with insurance rates and gas prices. And when you combine that with rent, a lot of people just don't have enough money to pay for gas. Preventing them from coming to work consistently and holding a job, and being able to pay their rent and bills. And the next leading cause of homelessness is domestic violence. And between 22 and 57% of women have reported that their homelessness is a direct result of domestic violence. In 2022, Josephine County had 626 reports of domestic violence, with 406 of those reports resulting in arrests. Long waiting lists for affordable housing can mean that many women and children are forced to choose between abuse at home or life in the streets. Domestic violence trauma has been proven to have brain altering effects that make it difficult for survivors to obtain stable housing for themselves, which can lead to homelessness. And also in the people that I've talked to, the clients that I've talked to who have experienced domestic abuse, not only are they having a safe place at home taken away, but a lot of the times these people will steal their income. The abusers will take away services like cell phone or car insurance, and all of those make it pretty much impossible to find another place to live. You're not going to be able to pay rent if you have all your money stolen. So the last thing on this list is incarceration. And incarceration can significantly contribute to homelessness, as individuals released from prison often face challenges finding stable housing due to factors like criminal records, difficulty finding employment, and lack of support networks, leading to a higher likelihood of experiencing homelessness compared to the general population. Studies show that people who have been incarcerated are significantly more likely to become homeless, with some research indicating that they are up to 13 times more likely than the general public. A criminal record can act as a barrier to securing housing, as many landlords may be hesitant to rent to individuals with convictions, limiting options for stable housing. Incarceration often results in lost income and debt, making it difficult to afford rent and other living expenses on release. So these are the leading causes of homelessness and factors around them. And while this is a topic that is far too deep for a 10-minute speech, I ask all of you to take home these facts and use them to partake and advocate for a system that uplifts those in need, so we can all work together to beat this crisis. Thank you.
Thank you so much, Quinn. Truly appreciate you presenting. Alrighty. So we have some time for a few questions for our local experts. If anyone has any. Comments, questions, maybe have a question.
The Dorcas building, Seventh-day Adventist owns that. They're gonna be working on some showers. They're gonna be asking UCAN for some help, maybe Rogue, Foundation help. And then we'll get people that are together to run it.
Oh, wow. That's wonderful news.
Yeah, in a couple of years ago, before we had the group path, right before that, when we were looking, the county was looking for a navigation center, and then everything, the perfect storm happened at the same time. Road Retreat pulled out, UCAN was going through some changes, and at that point, we were also working on that shower. So everything got put on hold, but it's been very dear to my heart, because it can totally change somebody's life, giving them showers on a regular basis.
Well, absolutely, and thank you for your work on that.
The Grand Pass Sobering Center has a shower and people use it all the time.
Is it just a single one, or?
It is a single one. If case managers or peer support or anything just calls over there, make sure we're not doing the admin at the time. Then we're going to bring them to the all over. they get a 10-minute shower.
And then you bring her home, right, and stuff, and so. Cool.
I really like them to have their own clothes, just because we keep a very small closet.
And thanks for that research.
We are in our map of kind of our property, the engineer just did it, you know, for Parker's Place. We have a whole building that is gonna be a shared shower, laundry, but that's not anywhere. My timeline and the city timeline is profoundly different, so I don't know when that's gonna be. But we are working in that direction.
You can right now, we have laundry cards.
Okay,
So if you guys wanna send people, we were able to use our all care funding, and me and Billy didn't know that you could just go buy reloadable cards for laundry, and we found that out, so we have laundry cards.
okay.
So, and soap available right now, so people can come grab cards and soap and do laundry. We got it for the laundromat across from CFD Market.
Yeah, I had 3 women that were interviewing with Foundry, and like all week, they're like, I need to do my laundry, because they're want to get the place, you know what I mean? It's so.
Yeah, so we have that available. So. Is it limited to like once a month or something, or? So. We wanna make sure that it lasts, right? We wanna make sure that everybody, so I've been trying to limit, if it's like a family unit, we'll give them 2, right? 2 a month, but maybe once a month, it's about. Yeah, they just come down, so you can office and let the front desk know that they're looking for a laundry voucher and let us know.
Awesome, Gray, are there any questions from?
Brandy's typing one,
Okay.
so if anybody else has any resources, feel free to shout them out.
Assume that I'm new to this portion of the work. That's why this question might be like, yeah, everybody else does this but me. Is there like a list of these resources that you share?
Well, we have the Josephine County Prevention Partners, and they have a website that lists a ton of partners that get together. We have a boots on the ground that meets pretty regularly, so I would recommend.
And I think I just got on that invitation, that's the boots on the ground.
Okay.
And so they have a website.
Yeah, the Josephine County Prevention Partners, and they have a resource tab. We just recently added some of the different housing options that were available that one of the city women put together. I saw that yesterday, so there's actually like affordable housing options listed on there, as well as other agencies.
Have you guys ever heard of the Retirement Connection book? It's like this little pamphlet, it's called Community Retirement Connection. They have a website and they update it on like every day. And it has every county in the state of Oregon, and it's for retired people, but everybody that accepts Medicare accepts Medicaid. And so everything, so you could type in, like, if you have someone that's gonna be moving to Jackson County and they have a dog that needs something, which we already know who the resources are, but you could type in Jackson County pets resources and it's gonna list everything. I have found that, like, if I don't know of a resource, I will often go to the Retirement Connection website, and I often find things that I didn't know existed. So just FYI, and I used to, it's so exhausting trying to keep up with the resources in the community because they change so frequently. And so that's been a really good place to double check things.
PAP also has the thing on their website. Yeah.
Does anyone have any other questions? Or Tyler, would you like to talk more about the mid-row?
I will let Susan get up and. So, Mid-Road Foundation, we have a mobile navigation team. We go and meet people where they're at. We help connect them to different resources. Primarily around housing, but just in general, we have funds to get birth certificates and other things needed for housing applications. We help track applications inside the system through licenses, and I'm a certified Oregon Health Plan Assister and Marketplace trained, so is the rest of our team. So we can kind of set you up with OHP, any resources, just help you navigate them. And we also have a couple of other programs. We took over operational control of Foundry Village, and We have our Evans Place program for 55 and older. Yeah, am I missing anything?
And we have a new veteran village that will be coming on board, probably 2026, which will be apartments for low income veterans.
Thank you, Susan and Tyler, really appreciate it. Any other questions or comments for our experts tonight?
I guess I don't. Just in general, when we talk about bridging the gap as a community or as individuals who want to help, what would be each of your guys' recommendations on something that we could do to better our community or to make an impact?
Get more involved at city council.
Oh, see, that's what I was gonna say.
Honestly,
It's tough, but honestly, like, there is such a beautiful, quiet crowd of amazing humans in Josephine County. And I'm a big fan of critical mass, and like, the more people that speak up, the more people are gonna try, I don't know, I just think it's critical.
Good one.
I think maybe, like volunteer work, maybe? Volunteer to go out and bring maybe clean water, maybe food, that type of thing. I'm just kind of thinking out loud right now of like, just instead of providers or peer support going out, just the average person that's concerned that wants to be supportive. Yeah, I'm just brainstorming there.
So Chris, for someone, who is wanting to help and go out to the community, what are some good questions to begin that are very trauma informed?
Asking the household population, I think it goes back to what I said, what happened to you?
Yeah.
Not instead of what's going on, all these different, like, what happened to you? Tell me, let's get a conversation going. Let's figure out what the need is. What's the first need that we need to address? And how can we do that? You know, and just providing that support and that information, and I think Kat said it too, it's just like walking alongside them. And whatever that looks like. Sometimes it's just a pat on the back and saying, hey, you know what, it's gonna be okay, we're here with you. Sometimes that's all somebody just needs to hear. And sometimes it's just a little bit more than that, maybe a hug. Maybe it's just, you know, can I get you somewhere? Where do we need to go? You need to go to the sober center and get a shower. Thank you so much, Heather. Had I known that I could have been like, hey, let's call Heather. Let's get you a shower. You know what I mean? I appreciate that. And you can, you know, just, man, you need your clothes washed, or you need a voucher or a card. Man, I got you. Let's figure this out together, you know? Instead of these, I'm not gonna go into that pieces, but yeah, just coming together, man, and just, because like I said, at the end of the day, we're all human, man. We're all trying to figure this out together. Try to change the narrative of the stigma that surrounds some of those things. Just treat people with kindness and dignity and some respect. Not saying that's not, I'm just saying. So.
Thank you.
Also, another thing on volunteer work is that we can just do warming and cooling shelters. Oh, not this year, sorry.
We're gonna leave that to Nick this year.
On that note, we are gonna be doing some mowing tonight. We will be, I was just talking to them, we're gonna need a lot of help this year, just because we're not using daytime navigation there, so. We just applied for the city funding, so we're waiting for that to go through, and then we'll be hearing from them.
Ask you if that just during the day or overnight stay?
No, we'll be doing overnight. What I anticipate will happen is it'll become a 24-hour shelter, and so we're trying to figure out what the, and because we're open during the day, you know what I mean? So I don't know what this looks like, so we're just kind of preparing for. And also our building's leaking, which is super fun, but.
All right, we have a few questions, from folks online.
Yeah, so the first question is from Catherine. She says, what options are available for unhoused folks who experience illness post-hospital care.
So it's, a lot of it is depending on our primary care provider, they can always follow up with them if they have one, but every Thursday, we have a medical van that goes to J Street. We were going to the police station, but they've asked us not to park there, so we parked at Newman today. I don't know if that's okay long term, we'll have to talk, but we do try to bring a medical van with supplies to where they're at. I believe in the last quarter, 15% of the people we saw were hospital follow-ups. So there were people that were in the hospital that came and saw us that we didn't get a referral from the hospital. And then in addition to that, I probably get 1 to 2 calls a day from the hospital on folks. And, you know, we don't always intervene, depending on the situation. You know, yesterday I actually did a handoff to Hospital Rescue Mission, but, you know, it just depends on the situation, but Mitch will go to the hospital if an unhoused person reaches out to us or a case manager, and the healthcare authority and Mitch are solidifying communication pathways, and they're gonna start referring people to us sooner, so excited about that.
Thank you, and I believe we have another question.
Yeah, we have a couple actually. The next one is, in an ideal world, what would each of you, the presenters, have as your vision for community success?
I'll start wishing.
Affordable housing, that would be big, affordable housing and like having people in a position where they feel confident enough to sit down and do the applications and like show up to life, you know, they're like. I think that all the aspects, like on the spiritual, the wheel that we just went through. If we could just, I feel like we have a lot of things in place. I just feel like we need more community to come in. I love how she mentioned the city council. I've seen that they're starting to work with us to an extent because they're showing up there. You know, I think I'm gonna stop there, but
Thank you. Chris?
I mean, it's pretty simple for me, and I kind of just said it earlier. If we can meet the needs of social determinant of health, we can prevent or end homelessness.
Thank you. Sassy?
I agree with all of that, and I'll just add, hypothesis of generosity and just being curious. Like, what got you here? I love that. You know what I mean? Like, you don't need to go out and judge people and be like, I know how to fix you. I know how to fix it. You know, it's just not necessary, and it's a community problem, and as much as not everybody wants everybody at the table, everybody needs to be there, even if they hate homelessness. I don't care. Everyone needs to be there. And yeah, and so like, and solution focused, like, yeah.
Clayton?
So along with the affordable housing thing, because it's already been said, on top of that, I'd like to add better support for people going through mental health crises. As that leads to all sorts of different self-destructive habits, you know, drug addiction and such. If we can give better outlets for people and give them alternatives to drugs and allow them to have stable living, that would really help the situation.
Thank you, and I believe we have another question.
Yeah, the last one is just kind of, are there any plans in the works to increase, the phrase is stick-built permanent houses for unhoused neighbors?
I think they're, I mean, what I noticed at city council is so much focus on affordable housing in the future. And I think it's just kind of low key happening and no one's paying attention to it, but I know there's a lot of, I watched the city council and people are getting approved, and others in RV park recently that was approved, Mid-Road's doing tremendous work, right? So yeah, I think there's solutions in the work where our community seems to gap is where do people go until the solutions are there? You know, that's where there seems to be no answer.
Thank you. Any final questions for tonight before we wrap up? Yes, sir.
Outside of affordable housing, what are other bottlenecks or gaps in resources that you've identified?
Access to proper hygiene.
What did you say?
Access to proper hygiene. We talk about showers and clothing and the ability to obtain employment or even be able to walk into a room without people looking at you funny or, smelling your odor. I think that's a huge one.
Goes back to that wellness wheel.
I also think there's a significant lack of access to healthcare in general in Josephine County, and primary care providers are like, they're leaving rapidly and we're not recruiting fast enough, and so if you're unhoused, trying to get access to primary care is pretty challenging.
All right, well, we appreciate each and every one of you being here today. And special thank you to all our community organizations that are here with us tonight. We hope to do this, more in the future. We're hoping to do this every 6 months in each county. Our next session will be in Douglas County. We'll be talking about pathways to prevention, staying ahead of diabetes, so we would love to see you there. And yeah, feel free to follow us on social media to stay connected and see, our local events that are happening at our website. But yeah, we'll be here for a minute or two if you have any questions, but thank you so much for being here.
You're on. Yeah.